Let's talk herd. Hi, Dan. Thank you for
Hello,
coming.
you're welcome.
Hi. Yeah. So I was thinking about what we could talk about because it's quite a vast subject, dentistry for horses.
Well, it's one of
And
those things, it's amazing how much knowledge there is of one subject, and there's specialists within the field as well. So
exactly. Yeah.
it's phenomenal, really.
Yeah. But what really came to my mind to talk about is that over maybe the last 15 years, you'll know better than me, there's been a revolution, perhaps
Oh,
that's the right
massively, yeah.
word. Yeah, in the way that we understand the horse's mouth. And yeah, maybe I
Mm,
would say as a kind of lay person that it's around the balance of the horse's mouth and the way that the incisors and the molars work together, because maybe before it wasn't understood that the incisors need attention. And I'm not sure if that came from studying wild horses and realizing that wild horses have short incisors, that they don't get longer, like, horses often that are in captivity.
Well, that's the theory, that a horse that is living out will get adequate wear to all of its teeth, to its incisors, to its molars. They get. I also notice with horses that are near the beach with a sandy pasture, they get better wear to their teeth. They're just all that grit
Mm,
that just wears the teeth more
yeah,
naturally. So the problems they get are from lack of wear. So we have to file the teeth to put that wear back into the teeth to where they should be. There's lots of other factors. There's breeding, conformation. Horses' teeth are definitely getting worse from breeding. We're seeing more issues with teeth that we didn't used to see.
okay.
That's also
That's
because we've
interesting.
got better imaging, we've got brighter lights, better tools. Over the last 15 years, the tools have improved phenomenally.
Yeah.
I mean, when I first started, what was commonplace was a very small, quite dim head torch, and a lot of the things that I would see, like cavities now, you wouldn't have seen them. And in the olden days, people didn't even use a light at all, so you just wouldn't see
Wow. Yeah.
problems unless the horse had a raging sinus infection that was obvious. Then you would start looking for a tooth with a problem. But lots of things would just get missed because they just cope.
And do you think that's actually a good thing or a bad thing always?
Well, it's amazing what they can cope with. So sometimes the least invasive, what's the word, the least
Approach,
invasive
maybe.
minor treatment approach is sometimes all the horse needs. But some people would
Yeah.
argue that that's neglect, and you're not giving them the gold star treatment and spending a lot of money correcting a problem.
Yeah, yeah.
So it just depends, really. It's a minefield.
It really is. It's knowing what that line is because I think we like to feel like we're doing the most that we can do, but sometimes we kind of, often I think we overdo it a lot and we just create more problems.
The most important thing is lifestyle and diet. That makes such a big
Yeah.
difference. And I find some of my clients are really, when I say, look, this horse has got acid erosion, it's got decay around its teeth, they'll be very interested, and they want to look at the horse's diet. They'll have the hair analysed, or they'll do anything to improve it.
Mm,
And you'll get some that kind of almost pass the book, and they expect that my treatment can solve the
yeah.
problems for the horse's bad diet, but it can't.
Yeah.
So
So would you say that the ideal diet is like low sugar forage, cutting out sugar feeds with molasses and concentrates, grains, all that kind of thing?
yep, try and cut all those things, cut out the starch and sugar. So we want to avoid cereals wherever possible. avoid
Yeah.
soft, over-cultivated haylage where possible. If you have to use these things, use them for a short period. They don't want to be on it for a long time.
Yeah.
And just rough pasture, as much grazing as possible. It tends to be the over-fertilised, over-cultivated pastures that can also create problems. And there's a lot of healthy treats that have come out, and some of them aren't so healthy. They're made out of cereals and starches, and they're quite sticky, so they can stick to the teeth and cause tooth decay and erosion.
Yeah.
I had one particular horse I can think of, and it was 7 years old, and it had to have 10 fillings.
Wow.
And I looked at it, and even the vet was saying, "Oh no, it can't." I said, "This horse needs to go for X-rays." And I said, "There's something you're feeding it." I said, "I don't know what it is, but I said that it needs to go. It's obviously got a predisposition, but I said there is
Yeah.
something quite amiss here, you know." And so it had all these fillings, and then she admitted, "Oh well, I give it one treat before I get on it, one when I get off, one when I turn it out, one when I bring it in, every day." And it has a treat
So
ball as
it
well.
adds up.
And it was having these treats
Wow.
in its mouth virtually all day and overnight in the treat ball. And
Okay.
so it's just got constant erosion to the teeth. And they can get a little bit of erosion around the teeth, that's not a problem. But when this
Yeah.
had got inside the teeth, and it was starting to compromise the teeth, so you can increase the risk of fractures and also an infection inside the tooth. So, but we've caught it in time. It's been done, but she had to spend quite a lot of money to sort it out,
Yeah.
and it could have all been completely avoided.
And she just wouldn't have had
No,
any idea.
no.
So would you say in that scenario it would be better to feed carrots or apples because they're at least more natural?
Even just some mints, the odd mint, I don't think is a problem. Carrots have more sugar than apples, I believe, but it depends how ripe the apples are.
Yeah. But there is a faction of people now who are really against grass and grazing.
Yeah, it's quite important though. It's still important to get that natural wear to the incisors and the grit in the soil, and it's important, I feel.
Yeah, I mean I've come to the conclusion that the best thing for them is grazing, but like long grass, as long as it can be,
Yeah,
so that it's
that's what we do here. It's called conservation grazing. So you let the grass grow. Well, I'll talk about the British seasons, but up until sort of maybe July, end of June, July, you'd put them in it when it's almost gone to seed,
yeah,
and they're
exactly.
standing looking over the fence at the short green grass that they want to eat
I know.
because
Yeah, yeah, yeah. So
it's
true.
full of sugar, and they've got grass up to their bellies. So that's what we try and do. Or even if you do that with some of your fields and then have them on the shorter grass sometimes and alternate it.
Yeah. That's exactly like my ones because we left the hay field this year. We didn't cut it, and
Yeah,
they refused to even go down there because we haven't yet been able to fence the big field, and of course they can eat it really short. So I mean it's sweet and they love it. So it's
mm.
not ideal, because they get much
I mean, a little
fatter.
bit of that's okay. It's all about getting a balance, isn't
Yeah,
it? And
yeah,
older horses
exactly.
can take a
Yeah,
little bit more sugar. Once they've got into the
yeah,
teens, they need a bit of a boost
yeah. Yeah, that's true. And the vitamins as well in grass that you don't really get in hay. That's quite
in
important.
hay. Yeah. Mm.
Yeah. So what about the dentistry technique? There has been a shift, hasn't there, in a lot of areas where people are starting to address the long incisor issue now.
Um, yes and no. I mean, like we said, a lot of the horses in this country don't have a problem because we have a lot of grazing. So in the drier climates where they're fed on more hay, they just don't get that
Yeah.
wear. So And a lot of the horses that I see them very regularly, and I do a lot less incisor work now than I used to, and I just don't see the horses that need it.
Yeah, yeah.
But it's certainly a shift in terms of sometimes less is more. So if you can take less off the back teeth, then you won't need to do the front teeth. But if you do more aggressive work to the back teeth, then you have to rebalance the front teeth as well. So you can come full circle with it.
Yeah, because it's just like the way that they relate to each other, isn't it?
Yeah, and I have over the years noticed that when horses have got what's called a diagonal bite, even if it's only subtle, it usually
Yeah,
means that there's a problem with a tooth on the side that it's restricted. So if you look very closely, you might find something wrong. And then I've seen horses that have had a diagonal bite, we've corrected it, but it's come back. Even though the horse appears to be chewing normally per se, it it's
yeah.
come back. And then I had one recently where they'd taken the tooth out, and it had actually levelled itself off, and it was sat evenly.
Okay.
So it obviously was in some kind of discomfort with it.
So would you say that that's mostly to do with how the teeth are rather than their natural crookedness?
Well, that's how the horse has been. So uneven diagonal bites is caused by preferential chewing. So they're not
Okay.
chewing on the
Yeah.
side with the discomfort on.
Yeah. Yeah.
Even though there isn't like a major problem where the horse is not chewing at all on one side and it's gone completely wrong, it's just a subtle problem. So there's always a debate as to how much pain the horse is actually in from a tooth abscess or tooth decay. Now, I say in older horses that if they've got a tooth that's had an issue over the years, and then when they get older, the tooth will sort of infect, but the roots are quite short, so it doesn't go up into the sinus and go anywhere.
Right.
And they actually just
Okay.
they'll expel the tooth as it gets older, and it'll become loose. And then when they become loose, you can take them out, and there's less surgery involved. It
Yeah.
just depends how
Yeah.
much it's bothering the horse. And I saw one recently, and it had a cavity in its bottom tooth. It was when you palpated the jaw, it was sensitive more on one side than the other, and it just wasn't wearing right on the other side. And I said, this needs to go for X-rays, and I think that tooth's going to have to come out.
Yeah.
So I'm 99% certain it will need to come out.
Yeah. Yeah. Do you think that their like the state of their teeth affects their behavior and their temperament quite a lot, or is that not very
Oh, I
common?
think if they've got a constant infection they're having to deal with, it can just put stress on their immune system, stress on the body, and make them grumpy. And
Yeah.
well, there's two things, isn't there? There's pain, the pain threshold, and then how much that thing registers as pain. Then there's the pain tolerance of that animal. How much pain can it tolerate?
Yeah. Yeah.
And every horse is different, you know.
Yeah. Well, I suppose that's their way of telling us that that there's a problem.
Yeah, well, I have some horses that I see, and they've got a tooth that's broken in half. They've had half of it taken out and left the other half in. It doesn't look very pretty, but the horse is perfectly happy, chewing normally, its mouth's even. So why put the horse through surgery to remove a tooth? And when you remove the whole thing, then the other teeth will move into the space more. So
Yeah.
it's a difficult one. And sometimes
Yeah.
later down the
Yeah.
line, the tooth can infect. It needs to come out. Um,
Yeah.
it's always a difficult one, you
Yeah.
know, whether to call surgery or no surgery.
Yeah. And are they doing more surgery now?
Oh yeah, definitely. There's a lot. We've got a lot of good specialists now in the country that are doing surgery, and more cases are being noticed because people are becoming more aware that the horse is in pain. It may have a problem, that something that,
Yeah.
like I'm saying, a little cavity or a tooth root infection that probably would have got missed years ago, now they're getting
Yeah.
picked up.
Yeah. Yeah.
But in terms of the general routine dentistry, the actual doing it, yeah, the tools are now cordless. They've got more control of the power, they're quieter, so you can do a better, more precise job in a safe way compared to the old tools, which were quite dangerous to use. So the horse had to be sedated. There's always
Yeah.
the big question: should we sedate or not?
The
Not
debate.
to sedate or not to sedate? The big debate.
Yeah.
Um,
Yeah. How do you feel about that in general?
well, obviously, I'm an EDT, so I can't sedate them. So I'm always I have ways I can manage. I can cope, get into the position that the horse is more comfortable. You learn to work with the horse, whereas a vet can sedate, so they will choose to sedate
Yeah.
primarily. Some practices will only do dentistry under sedation. Their practice policy is that they will not do it without.
Right. Yeah. So EDT is equine dental technician.
Dental technician, yeah. But my argument is that you can do as good a job without sedation. If you're an EDT who's working without sedation on a regular basis, you just learn. It makes it easier sedating them, definitely. There are some drawbacks. So the horse's mouth dries up, so you have to make sure you rinse it so you don't catch them. You've got no saliva in there, so you can give them a friction burn or catch the tongue more easily.
Yeah. Yeah.
The they go very
Yeah.
sleepy. They have to hold the head up, lift and support the head in an unnatural position.
Yeah. Yeah.
And obviously, it's quite a potent drug. It alters the blood pressure, the heart rate, and then they need like an hour and a half, 2 hours maybe to recover afterwards.
What about balance? Does it alter the way they hold their jaw?
Some people say it gives a false picture, so it relaxes all the muscles, and you don't get a true picture of where things are when the horse is awake. I don't know where I stand on that. I think you can look. You can certainly look a lot deeper into the biomechanics of the jaw when the horse is sedated, and you're doing a different.
Yeah. Yeah.
Well, when I work on a sedated horse, I'm doing a totally different level of work. But generally when the GP vet sedates a horse, they are just doing that basic level of work, but under sedation to make it easier. They're not
Ah,
looking
okay. So
at
that's the difference.
the biomechanics. Yeah, some
Yeah.
vets do and some don't, and a lot of it comes down to opinion. You could ask, 10 dentists to do a horse's teeth, and they'll all do it a different way, and who's right and who's wrong.
Yeah. Do you ever get frustrated with that vets do dentistry and they might not know, they're not specialists necessarily?
Yeah, well, a lot of the practices now they've brought out these what they call health plans, and you get a routine flu jab, dental examination, and treatment. But they're often sending out an inexperienced younger vet to do the work, and not sending out the actual dental specialist. Um,
Yeah.
but they have to learn. But then people think that they're getting a really good deal, but you're not going to get the specialist out for what they're paying for the health plan. So
No,
if it
exactly.
sounds too good to be true, sometimes it is.
That's the thing. I suppose that's okay if the horse is, relatively okay and there's not much there. But
I don't want to say anything that. It all comes down to opinion,
yeah, yeah,
and it's very easy to look at somebody else's work and criticize it.
yeah, yeah. It's like all of those things, isn't it? You just have to go with your as an owner. I suppose when you know your own horse better than anyone else, so you've got to just trust your intuition and if you know that something's wrong, then you keep asking questions.
Well, I give you an example. So I looked at a horse yesterday, two horses, and they had both been done 6 weeks ago. She'd asked me to go and look because she felt a competition horse wasn't going as well after it had its teeth done, and she wanted a second
Okay.
opinion. So I went to look at it. I said, okay, they've done a reasonable routine job. They've maybe done more on the upper teeth and not the lower teeth. But the horse has actually got peripheral caries or decay around the teeth, and it's very, very rough on the outside edge of the bottom teeth. And it's actually, it's got quite a few
Okay.
ulcers where it's catching itself. So that hadn't been addressed, and they hadn't pointed out to her that it's got tooth decay. And she was quite very into nutrition, and she did have her hair analysed, and she was quite willing to change whatever needed to be changed. So, but she was completely unaware that the horse, why. And I said, I think that's why he's been funny, because he's got some ulceration, but not typically where you would get ulceration.
Right.
So I did it. I said, I would take the ridging out a little bit more, change this. His incisors were a little bit long, but they weren't too bad. But that's the problem. The position I was in was there was no vet there, so I can't sedate the horse. So I had to just do the best I could with the molars and not take too much off and keep everything in balance. It probably will need an incisor reduction, that horse, because it is kept in more because it's a competition horse. Whereas the other horse
Yeah.
that I looked at, she hunts him and he gets a lot of turnout, and that its incisors were absolutely spot on, perfect, didn't need any adjustment at all. And at the back, the horse had no peripheral caries or decay at all. So the diet was working for that horse. But he was a heavier, thicker, tougher horse that's teeth would be more resistant to decay than acid erosion. Whereas the other horse is an Irish sport horse, just a bit more finely bred.
Yeah. And also staying in, like being in more, is more stressful for them. So presumably they would have a more acidic system.
Yeah. Well, she was thinking he had stomach issues as well, so he was off to get turned away for a holiday.
Yeah.
So the point of that is that I've done an improved job without sedation, whereas it was done 6 weeks ago under sedation,
Yeah.
and that's the problem. And there are some horses that I'll look at this horse and I'll say, no, it needs sedating. There's too much work to do, or it's not going to have it. It needs to be sedated. So it's very frustrating not being in control of the sedation. And the only way
Yeah.
that I could be was if I went back to vet school for 5 years, which I'm not prepared to do. And you can't work. I have to study full time.
Yeah. It's a pity that they can't offer people like you who are specialists a course or a qualification, like just a short thing that was based on sedating a horse, because how difficult can that be? You know?
There's too much sort of politics and money involved, and the way the veterinary
Yeah.
association look at it is that they've realised that the vets have been neglecting horses' teeth for years, so they're now training more vets to do horses' teeth and train them properly. But the problem is they do 5 years in vet school, they come out, and then they have to start doing more training to train in dentistry. So it's a lot of training. And there's a specialist who I work really closely with. I go and work for him some days, equine veterinary dentist,
Right.
and he does extractions, fillings, restorations, all sorts. He's fantastic, and he's dedicated probably 10 years of his life to train to get to where he is, and he does things as he does a competitive pricing for what he does as well. So it's just a lot of training to be.
It seems like it would be more sensible for them to branch off earlier as vets if they want to study dentistry.
You would you'd think so. While they were doing it halfway through the degree, they could sort of specialize into small animals or large animals or equine. Or that's the problem. It's it's very difficult, and it's not, and it's also, you've got to look at it from the young vet's point of view. It's not fair to them to be put in that position. So they'll say, right, this person's on the health plan. You go out. They'll often provide them with basic, cheaper equipment. They'll say, right, you've got to go out and do the job, and it's not fair to put them in that position.
No, not without, because it's a whole different ball game, isn't it? It's a whole different thing.
Yeah. And the only way it works is to have an apprenticeship. That is the best way to train, because you're seeing it hands on.
Yeah, learning from someone.
And that's the way the British Association that I'm in has gone to apprenticeships. I don't have a student. I'm not at a stage in my life where I want one. I keep thinking about it, but we've developed an apprenticeship training program, and hopefully it'll become sort of recognised by the government when we get legislation that comes through, so that we're more recognised. But at the moment, we're still in the early days with legislation. But it's been going on since 2001, and we're still no further forward. But they're talking about bringing things in now to include barefoot trimmers and physios and dentists. So things are happening at the moment.
Yeah. So do you think that, just to get things back to a more spiritual tone,
We've done the legislation, and
but when when you're working with it, I always find this really interesting, because I prefer to do things like any kind of care type thing myself with my horses, because I can I can do it the way I want to do it. I can take as long as they need to trim their feet, and listen to them and dialogue with them. So does that come up for you a lot, the issue of, like, do they know that you're helping them? Do you think they know you're helping them?
I think some horses do.
Yeah,
I try and tune into how they're feeling, work out what they don't like, what they don't
yeah,
mind. You'll get some horses that really hate my arm in the mouth. I can put the tool in, do anything. As soon as I put my arm in, they'll violently gag and be quite object to it. And so I learn and you learn to work when you put your arm in, not to upset the tongue, and you just get a feel for what that horse
yeah.
likes or doesn't like.
So you don't feel that you've become hard and, like, more kind of because you're doing it as a business, so you're trying to get it done as well. So I mean, it's a lot of pressure.
Oh yeah, there's definitely an aspect of that.
Yeah,
It's you're under pressure to pay bills, earn
yeah,
money. So yeah, you're under pressure. So sometimes that does take over. I mean, I have some days where I'll only do, say, 4 or 5 horses. I'll do one here, two there, and one somewhere else. And then I have some days where I'll have 10, 15 horses in one place. And I enjoy a mixture of the two. And it's nice some days just to have more time with the horse. And I always try and make time. But I've developed my process of doing the teeth to be as efficient and as quick as possible,
yeah,
so that you can not upset the horse, because generally you
yeah.
get half an hour, 40 minutes before they'll get upset. So you do have to get it done as quickly as possible.
Now, do you think that that's because they get sore in their jaw, or do you think it's their attention span? They're just like, this is a threat now. I need to.
Both, yeah, they get sore in the jaw. They don't like the vibration on the teeth as well.
Yeah,
Also, it can make them gag
yeah,
when you're going right to the back of the mouth. They don't
yeah,
like it.
yeah,
Um,
yeah.
and they must have to concentrate as well.